There are multiple different technologies which are on display here. For example, I looked at this robot which allows you to do remote ultrasound. Well, you know, we have a heck of a time in our lab recruiting and retaining ultrasound techs. There's not enough of them. And the idea that we could improve efficiency by having somebody remotely do the scan is a big deal. So I call our VP for the Heart and Vascular Center and say, you got to come up here and look at this. This may help us immediately with some of the challenges we've got. That's just one example. The other examples here are, there is a fairly new robot that are really looking at microvascular anastomosis. And what we're talking about is joining tubes, blood vessels, or lymphatics that are less than 2 millimeters, or super-microsurgery is defined as less than 1 millimeter. You can barely see these blood vessels. And it's really limited, because of lack of expertise, our ability to even think about joining those kind of blood vessels together. But now you got a robot that allows you to magnify what you're looking at. So instead of looking at this vessel you can barely see, all of a sudden it looks huge. And it also measures your tremor, because when you get down to tiny blood vessels, everybody's got a tremor, and it allows you to measure your tremor, and it takes that out from the robot. It's exciting for a variety of different reasons. Number one, I think it's going to open up a whole new vista of potential procedures, and I think it's going to provide more care to people who just don't have access to this kind of super subspecialization, if you like. We're going to see this fusion of imaging with robotics. And then the other groups that are up here today is VR and AR. How do we incorporate that into an operating room? If you'd ever told me that in the thoracic surgery world, 95% of lung resections, esophageal reconstruction were going to be done with a robot, nobody would have believed that. And so I think you're starting to see it spread into other fields. Because it's been adopted and successful, it's commercially viable. So now what you're starting to see is other companies starting to build surgical robots. So we welcome competition. I think it also brings in a lot of other smart people and engineers into the field. And I think you're beginning to see this rapid emergence of these new technologies that's going on to an exponential growth curve. And we're just happy to be part of this.